Today, I'm going to teach you something that I wish someone taught me when I was a patient. What is the real root cause of PCOS? Because for many women, the moment they walk into a clinic with symptoms like irregular periods, acne, weight gain, or infertility, they're often given a diagnosis polycystic ovary syndrome and then quickly prescribed birth control pills and or metformin and others. Many patients are told they have PCOS, but do they understand why their periods are irregular, why androgen levels are elevated, or why ovulation is disrupted? Here's the question we need to ask. Is that really treating the root cause? So, in this session, we're going to break down the pathophysiology. When we say pathophysiology, we're asking one key question: what processes inside the body are leading to the symptoms we see? Because PCOS is not just an ovarian problem, it is a complex hormonal and metabolic condition involving multiple systems, not just the ovaries. You will start to see why so many treatments only manage symptoms but don't actually fix the drivers. So, in this session, we are going to break it down step by step from hormones to insulin signaling to ovarian response because once you understand the mechanism, the symptoms will start to make sense. So, let's break it down. What we see in PCOS often starts with menstrual irregularities, irregular cycles, missed periods, or even heavy bleeding. But these are not just random symptoms, they reflect a deeper issue: disrupted ovulation. As ovulation becomes irregular, follicles begin to accumulate in the ovaries. This is why they see multiple small follicles on ultrasound and why many patients experience difficulty getting pregnant. But the impact doesn't stop there. When ovulation is not occurring regularly, the endometrium is continuously exposed to estrogen without proper progesterone balance. Over time, this can lead to abnormal uterine bleeding and increased risk for endometrial hyperplasia. So, what looks like a menstrual issue is actually a cascade of hormonal events. And the question now becomes, what is driving this disruption in the first place? Now, let's go deeper into what's actually happening inside the body. We said earlier that ovulation is disrupted. But why is follicle maturation disrupted? One key factor is elevated androgen levels, specifically free testosterone, which is why patients experience acne, excess facial or body hair, scalp hair thinning, and oily skin. But where is this excess testosterone coming from? Two main mechanisms are happening at the same time. The ovaries are producing more testosterone, and the liver is producing less SHBG, sex hormone binding globulin. When SHBG is low, more testosterone remains free and active in the body. And what is driving both of these processes? Hyperinsulinemia. High insulin levels stimulate the ovarian theca cells to produce more testosterone. And at the same time, insulin suppresses SHBG production in the liver. So now we start to see the connection. Insulin is not just about blood sugar, it is directly affecting hormones and ovulation. So the real question becomes, why is insulin elevated in the first place? So now we answer the question, why is insulin elevated? The underlying issue in many cases of PCOS is insulin resistance. This means the body is not responding properly to insulin. So the pancreas compensates by producing more, leading to chronically elevated insulin levels. And this is not just a lab value, it shows up as real, everyday symptoms. Patients may experience fatigue after eating, sugar cravings, weight gain, or difficulty losing weight, increased belly fat. darkening of the skin around the neck, or skin tugs, and many others. These are not separate problems. There are clinical signs of insulin resistance. So, when we ask what is the root cause of PCOS, in many cases it begins with insulin resistance driving hormonal imbalance. And now that we understand the driver, let's put everything together. I said insulin resistance. But what really causes insulin resistance? In PCOS, multiple factors like diet, chronic stress, sedentary lifestyle, environmental exposures, and genetics can lead to insulin resistance. Insulin resistance then leads to chronically elevated insulin levels. And this is where the hormonal disruption begins. High insulin levels decrease SHBG from the liver and stimulate the ovaries to produce more testosterone. This leads to increased free testosterone, which explains symptoms like acne, hair growth, and scalp hair thinning. And as androgen levels rise, follicle maturation becomes disrupted. This results in irregular or absent ovulation, irregular periods, missed cycles, or heavy bleeding, and difficulty getting pregnant. Over time, follicles accumulate in the ovaries, and the endometrium is affected, leading to abnormal uterine bleeding and increased risk for hyperplasia. So, when we ask what is the root cause of PCOS, it is not just the ovaries, it is a metabolic and hormonal cascade, often driven by insulin resistance. This is root cause CSI, where we don't just accept your label conditions, we investigate the root cause. Because when you understand the root cause, you start understanding your body. I'll see you in the next one, where I will be discussing about diet to avoid insulin resistance. Keep learning.